Hi everybody, it's Dr. Cary Yurkiw here. Thank you for joining me this morning. And today I'm going to go over neck misalignments and how that causes neck pain. We do the Instagram and YouTube live on Monday, Wednesday, Friday. So please join us, and I'll let you know on social media what the upcoming topics are. So I'll give you a heads up the day before, or even 2 days before, letting you know what the upcoming topic is. I wrote this book called Neck Pain. It's on Amazon, and it was written 3 years ago, and it has a variety of different topics in it, like spinal function, causes of neck pain, arthritis, whiplash, concussions, headaches. It's the most popular book that I wrote, and the audiobook did really well. It outsold the print and the ebook copy by a long shot. So one of my thoughts is in 2023, what I'd like to do is improve on that by writing a second edition. So I'd like to write a second edition of this book called Neck Pain and have that published on Amazon and do an audiobook version. And right now I'm doing research for that. I'll be sharing that research with you guys here on Instagram Live and on YouTube Live in the coming weeks as I get ready to start writing that manuscript in January 2023. I'm hoping to have that done by spring, so the book should be ready by spring. And one of the topics will be on spinal misalignment. So if you're here on YouTube, just going to switch over to my slide on spinal misalignments. If you're on Instagram Live, just follow me, and then later you can go to YouTube and see the recording of this video. So spinal misalignments, what causes them and what can we do about it? So how do we get spinal misalignments? Spinal misalignments can be the result of injuries. Let's say you had a fall or an accident or a car accident where there's whiplash involving the neck area. It can cause the bones to go out of place, and then those bones don't go back into place. They stay out of place, and now your neck alignment and your posture is affected by that injury. Stress can cause misalignment. So people who hold tension in their neck, they're scrunched up, or tightness, can change the alignment and the curvatures in the spine. And that can cause misalignments and pinching of the nerves that come out between the bones. Posture, poor posture, especially at your workstation or texting, on your phone. People are looking down. We call it text neck. So conditions where people are have a poor position of their head. The head weighs a lot. So if you have it forward, it's got some momentum with gravity to cause strain on the neck. And so we can see text neck or poor setups, workstation setups causing neck pain. And certainly in this setup, you can't see my setup right now, but I've had to work on this to get some platforms to elevate my monitor, to get this stand for my phone, for Instagram. So everything should be at eye level or just slightly down. Now I have a monitor just above this monitor, so I have a second one. So if you see me looking up, it's because I have a second one. But basically what you want to do is have your head and your neck moving around that central plane as your focus. So that parallel plane to the ground or the floor as your central focus. Same thing in something like your car. You want to adjust your car seat so that you don't have too much strain on your neck or your posture's poor, so you're reaching or you're scrunched up in the car seat. So that's another postural tip for you guys. There could be an underlying condition as well. Sometimes we see things like osteoarthritis or osteoporosis, and that can cause neck pain too. So you want to get a proper assessment, get some things like x-rays or MRI, CT scan can really help to diagnose an underlying condition. And then once you know what your condition is, then you can work with your health professional to do something about it, to make it better. So what do I do in the clinic? Well, I'm a chiropractor, so I do chiropractic care. And what I do is adjustments to the spine to improve the alignment and the function of the neck area. That reduces the pain, improves the muscle balance, and improves the function of that area. Then I give the patient some stretches to do. And those stretches are level 1 and 2. Level 1, pretty basic, like the cat and dog type of stretches. And then level 2, a little bit more in depth. Things like thread the needle, planks, those types of things. And then level 3 is more strengthening of the spine to stabilize it so that it doesn't go back out of place, so it doesn't cause pain and discomfort again. And then we talk about posture, either with the patient individually. Sometimes I do a video like this and send it out to the patient. And then I talk about how the patient can improve with their posture. And then lifestyle. Talk about mattress, the proper pillow, sitting at your desk, sitting in a car, sports, those types of things that can impact the alignment and the function of the body. The way I do my treatments is I do manual adjustments to the spine. Sometimes I use instruments to adjust the spine, like the activator or the integrator. And I use tables to do adjustments as well. So I use different techniques depending on the condition of the patient and depending on what works for them. Some people, the instrument works better. Others, the manual adjustments, traditional adjustments work better. So it all depends on the person and what's going to produce the best outcome. The services I offer include X-rays in the clinic, shockwave, and laser. Now, shockwave is an impulse instrument that goes into the body, breaks down scar tissue, improves the healing process in the joints. Laser does much the same, but it works with a cool light versus a mechanical force. And then decompression. And this is something new for 2023. So some traction and decompression for the spine to improve the alignment, the spacing between the bones, especially in the upper part of the neck area. I was telling someone on the weekend about my mother, and this is a good example of decompression, because when I was a child, she was hanging clothes outside on our clothesline, and we had one of those manual clotheslines where you had to pull the string, and the end of the clothesline on one side and the other would go up, and then you'd clip your clothes to the clothesline to dry it. And when she was hanging clothes, the end that supported the wires released, and she was right underneath it, and it fell and it hit her right on the head. And that caused a compression of her neck area. And that compression was at C1 and C2, right at the top. And then she started to get migraine headaches, and those migraine headaches were really debilitating to the point where I'd come home from school and I'd see her in the living room with the blinds closed, sitting in a rocking chair, just kind of hunched over. She looked like she was in a lot of pain. And so later, when I went to chiropractic college and graduated, my mom was my first employee. And when she came to work for me, one of the things I did was check her neck and gave her adjustments. And it took a couple years, but eventually her headaches went away. And I was just asking her this a little while ago, and I said to her, Mom, when did those headaches, those migraine headaches eventually go away? And she goes, well, when I started working in your clinic, that's when the headaches went away. So the adjustments decompress that upper cervical area at C1 and C2 right at the top. And I find a lot of times that can cause headaches. If somebody has misalignments there in the upper part of the neck, they get a lot of headaches, including headaches like migraines. So I want to thank you for joining me today here on Instagram and YouTube Live. I really like doing these presentations and educating people. Our YouTube channel has grown tremendously in the last little while. The fastest it's grown since I've had a YouTube channel, and that goes back years. I think we have videos there from 8 years ago. Thank you for subscribing to our YouTube channel. Thank you for subscribing to social media, to our channels on social media. If you're in the Kelowna area, you want to come into the clinic, I am accepting new patients. If you're not in the Kelowna area and you're interested in chiropractic, you can certainly comment or DM me. I'd be happy to refer you to a chiropractor in your area. And the other thing is, in 2023, with the release of this, the second edition of this book called Neck Pain, which I'll put in the show notes below the link of where you can get this. Or you can click on the link in the bio if you're on social media. What I'm thinking of doing is a course that would be a self-study course that people could sign up for. So my patients can go on and then learn the levels of stretches. So basically, the research I'm doing right now that'll be included in the book, the second edition, like stretches for arthritis, let's say. I'm thinking of doing a course that people could take that themselves and study the stretches they would need to do if they had osteoarthritis. So let me know what you think. Please comment here in the show notes, as well as DM me. I'd be happy to hear from you. Also, please join me on Wednesday. I'll let you know tomorrow what the topic's going to be for Wednesday. And then we'll have another video, YouTube and Instagram Live on Friday. And all 3 days, it's at 9 a.m. Pacific. So please join me. Please join me here for the Instagram and YouTube Live. And thanks for joining me today. And I will talk to you guys soon.